This is Red, White, and Bluegrass.
Medicaid is shaping to be the next big political fight in D.C. with high stakes for the Commonwealth. 31% of the state is enrolled in Medicaid. That's about 1.3 million people. Leaders with the policy nonprofit Kentucky Voices for Health argue the current plan's work reporting requirements will create more, quote, bureaucratic churn when 96% of non-elderly Medicaid recipients are already working, and missed paperwork could cause them to lose coverage. Kentucky Senator Rand Paul says they are a good thing and told me this week that there will be no major cuts to Medicaid.
Every time you submit this information, it has to be processed. If it's not processed in time, you could have done everything right. You still lose your coverage. We see that happening in Kentucky today.
I applaud the attachment of work benefits to it. They aren't done to cut people off. They're done to try to get people learning and getting used to the idea of work, and with the hope that we get them off Medicaid and into a job that has private insurance.
Beauregard says that under the current proposal, more than 100,000 Kentuckians could lose their health insurance. The bill's future is still uncertain. Paul says that his vote will be in play over whether the debt ceiling is raised. On Friday, the bill did not pass out of committee as some Republicans joined Democrats in blocking it. That group of lawmakers saying they want to see steeper Medicaid cuts. So, Andy, I want to start with you here. Do Medicaid recipients on this issue just have a right to be concerned?
Well, look, I mean, I think the thing that you pointed out was, it's an ongoing discussion. Today, it did not pass through the Budget Committee. So, I mean, they're going back and they're going to discuss it and they're going to look at it. But the big thing that people need to remember right now is each year we are paying, I think, over $880 billion in interest on our debt. That's over $200 billion more than we're actually paying towards Medicaid services. Something else that should be remembered. We are going to spend more year after year on Medicaid than we will this year. So it's going to grow, but what we're trying to do is get a handle on this program, adding work requirements, making sure that Medicaid is targeted at the people that it was intended to benefit is not a bad thing. Able-bodied adults should, be working. Medicaid is there for single mothers, children, the elderly, and the disabled. So all we're trying to do is just get a handle on, making sure that it is intended for the people that it was targeted.
Blair, what are your thoughts on this?
I think it's a very scary time right now. Nobody mentioned Congressman Brett Guthrie of Kentucky, who's led the charge in cutting Medicaid. As you mentioned, 1 out of every 3 Kentuckians are on Medicaid. Half of those are children. So it's very scary when we start talking about those cuts, and we definitely need to take our time to figure out if there are ways to save money, what's the right way to do it. So our children here in Kentucky, one of the highest states with folks on Medicaid will continue to get the coverage they need.
As we zoom out on this argument, why is it that Medicaid is ultimately the big issue when we're talking about cuts? I know you touched on that a little bit there about the rising costs, but is there any sort of better avenue to reducing spending that isn't necessarily around?
Well, I mean, we're doing reduced spending across the board if you're looking at DOGE. So we're looking at ways that we can find ways to cut the bloat and figure out ways to streamline the federal government. Medicaid is just one part of that.
I would just say that when we're talking about these tax cuts and these programs, who is benefiting from that, and is it the wealthy with their tax breaks on the expense of the working class families? And there's been studies done actually by Congressman John Yarmouth when he was serving about what the debt really means, and I think there's a lot more that we need to look into before we start cutting things across the board.
Well, since you mentioned this is still just an ongoing discussion, the bill didn't pass out of committee Friday. We'll have to see what happens over the next week. What happens if the bill dies? What really kind of happens next? Where should this conversation sort of go?
I mean, this is the legislative process. This is where the debate happens. Congressional members will come to the table and they'll discuss ways forward. It's tough to say, at this exact moment in time, what the next steps are going to be. But, that's how this works. That's how, our government works. We continue to discuss and we continue to debate. So, tough to say at this exact moment, but I'm sure we'll have a lot of spirited conversations next week.
Where would you like to see things go in terms of cuts with this administration?
we've got to really take our time and not have everybody hurting before we build things back up. We can't burn it all down. And we have folks that seniors in rural Kentucky who used to be able to get their Social Security benefits over the phone and now are having to drive hours to get it. We have children on SNAP benefits and could worry about starving with offices closing down, people losing their jobs in rural Kentucky as we're cutting these programs. So I'd like us to really think before we act.
In just a couple of seconds here, as we wrap up this segment, this will still be part of the conversation over the next couple of weeks. What would you advise our lawmakers to really be telling their constituents who may be concerned?
Well, first and foremost, let's not, pander to scaring people. This is an ongoing discussion. I understand the Democrats are in a little bit of a tight spot after spending $2 billion in 24 on the election, and basically by every measure blowing it. They've got to whip up support and whip their base up. So this is a way for them to fundraise. But at the end of the day, Congressman Guthrie is one of the most thoughtful people we have in DC, and there is no way that him or Congressman Hal Rogers from the 5th District are going to allow a policy to go through that are going to really hurt Kentuckians.
And your advice?
I'm just glad to hear that. I think we have a lot of folks out there that are calling their representatives and their senators and asking for these things not to be cut. So we got to keep doing that, making those calls and making our voices heard to all of our representatives.
All right, we'll have to leave it right there.